Colorado was once known as the hate state. The moniker was given after voters approved an amendment in 1992 that prohibited legal protections for LGBTQ+ people here in the state. 4 years later, the Supreme Court overturned the amendment. In the nearly 3 decades since, Colorado has done a 180 and is now known for its progressive stance on LGBTQ+ rights and laws. Everything from employment to housing to inclusive sex education. And health, like a law that ensures non-binary and transgender people have access to the care they need. When Elliot Harris was a kid, the way he was socialized didn't feel quite right.
Myself, my actual self, just did not form a super strong relationship with girlhood or womanhood, or any gender, really.
Elliot has struggled with mental health for most of his life. He remembers having his first suicidal thought and the depression that came with it around 9 or 10.
Coincidentally, that is also when I started developing my body, especially. So the timing was very interesting on that.
The 29-year-old has been in therapy for over a decade and made great strides by taking medications and learning coping skills. But even after doing the work, he would find himself back in a state of depression. Elliot didn't know it at the time, but he was dealing with gender dysphoria. It's the distress some people feel when their bodies or society's perceptions of them don't align with their gender. In 2022, Elliot began his medical transition, which included taking testosterone. The side effects were less than desirable. Itchy, bumpy skin, congestion, kind of like a teenage boy going through puberty. But despite all this, he felt better, physically, mentally, and emotionally. It was like a fog had been lifted.
The depression and the suicidality went away as I transitioned and as the testosterone really just kind of settled into my body. And I feel just generally happier, easier able to cope with the stresses of life.
Hormone therapy isn't the right choice for everyone with gender dysphoria, but it worked for Elliot, along with regular therapy and support from family and friends. He's now an openly transgender man and in a much better place, but he's still evolving. I'm Stephanie Daniel, and this is The Colorado Dream, Ending the Hate State. Colorado is considered one of the most LGBTQ+ friendly states in the country, but it wasn't always this accepting. This series investigates one of the darkest times in the state's recent history and the activism and legislation that followed. We'll share the stories of LGBTQ+ people and the allies who want to make the Centennial State a welcoming place for all. This is episode 3, Gender Care. It's May, and Elliot is dressed casually in gray sweatpants and a t-shirt. He's sitting in an exam room at a Denver health clinic for a checkup with his primary care doctor, Corey Walsh.
Well, hey, Elliot.
Hello.
Thanks for coming in today.
Yes, of course.
Elliot's been seeing Dr. Walsh since 2022, and this is his last appointment before having top surgery in 10 days. Elliot's brown eyes light up behind his glasses when he speaks.
That is very exciting. I'm prepared for that. My partner is available and is helping me.
So I think you're going to do great.
Dr. Corey Walsh is one of over 100 providers who have received training to serve LGBTQ+ patients at Denver health clinics throughout the county, while other staff, like security, the front desk, and nurses, have been trained on how to interact with these patients in a way that's affirming of who they are. Dr. Walsh is also queer and originally became a doctor to provide care to trans patients.
I have a number of very close people in my life who identify as trans and had seen all of the struggles that they go through.
We know that if you're a Black trans woman, you are facing many more issues than somebody who has a different identity in terms of healthcare outcomes, in terms of housing, in terms of employment, in terms of so many different factors that impact our health.
That's Dr. Elizabeth Petty, the Senior Associate Dean for Academic Affairs at the University of Wisconsin School of Medicine and Public Health.
Some segments of the LGBTQIA+ population, there's also higher incidence of substance abuse, higher incidence of obesity, higher incidence of tobacco use, a variety of other kinds of things.
Another big health concern is the risk of suicide. The data is alarming. A 2016 study found 17% of queer adults had attempted suicide during their lifetime, compared to less than 3% of the general U.S. population. Last year, a national survey found 41% of LGBTQ+ young people had seriously considered suicide in the past year. Colorado has emerged as a leader in gender-affirming healthcare for trans and non-binary people, which can include treatments and procedures like puberty blockers, hormones, or surgery. Medical experts note that similar care is also given to cisgender people, folks whose gender identity matches the sex assigned to them at birth. But for trans people, this care can be life-saving. But nationally, LGBTQ+ people are not getting the mental and physical health care they need. Another national survey backs this up. It found that queer and trans adults face higher rates of discrimination in healthcare, including barriers to access. So how can they be better served? One solution: increase the number of doctors who know how to treat them.
How prevalent is training in medical school and in residency programs?
Yeah, that's a good question. So it's not fully understood because that kind of training or those outcomes aren't measured at a national level.
A decade ago, the Association of American Medical Colleges put out the first guidelines to help medical schools teach students the skills they need to care for LGBTQ+ patients. Dr. Petty says schools have been adding content in different ways.
But it's still not comprehensive, and there's still gaps. Some of the studies that have surveyed medical students will still say they're not getting adequate training in that area.
Dr. Corey Walsh was not one of these students. He attended the University of Colorado School of Medicine and says when he started in 2017, it had a robust gender diversity program. That was thanks to the work of several faculty members, including Dr. Rita Lee. Dr. Lee has been a general internist for over 2 decades. She came out as a lesbian during medical school and says as a patient, she personally had several healthcare experiences that were, quote, less than friendly. This included a lecture about birth control, which she didn't need, being in a same-sex relationship.
And it definitely created almost like a sense of shame for myself. And I thought, if I am an empowered person who is in the healthcare training system and this is how I'm feeling, what are we doing to our patients in this space?
Dr. Lee received very little LGBTQ+ healthcare education while in med school. So she says that became an area of focus for her. In 2009, she was part of a training program to examine CU's existing communications curriculum and make changes. But back then, there were limitations on what she could do.
We were a very different state in 2009. So when I first did my education project, I wasn't allowed to specifically focus on sexual history taking as part of my project. So it was actually embedded in a more general communication project around taking the social history.
Dr. Lee asked students about their comfort level taking specific components of the social history, like around tobacco and alcohol use. When she saw that students did not feel adequately trained to do this, she piloted a program to expand education in this space. Dr. Lee took this routine history gathering a step further, adding inclusive sexual history questions to help LGBTQ+ patients feel welcome and more comfortable answering honestly. This included asking people what pronouns and names they use.
And also using language that is typically gender neutral and very inclusive. So instead of, do you have a boyfriend, it would be, do you have a significant other?
When the pilot program ended, CU permanently added this training. The sexual history taking curriculum was so popular, it was integrated into the core curriculum. Then this inspired some students to create an LGBTQ+ health elective, the content from which has been integrated into the curriculum as well. One of those students was Dr. Corey Walsh. He says this long-term training reinforces an important idea.
This is just part of a doctor's job, and this is part of our training, and this is the expectation that we all have for one another in this field.
Training more doctors is key to providing effective care. A national 2020 survey found a third of transgender respondents said they had to teach their doctor about transgender people to receive the appropriate gender-affirming care. Although according to Dr. Walsh, there's some debate around use of the term affirming.
Even some people are pushing for this to just be called gender care. Like, what other part of being a doctor do we call affirming? We don't call it diabetic affirming care, it's just diabetes care. I have an idea of what year and month you may have gotten your cervical cancer screening, the Pap test?
Back in an exam room at Denver Health, Dr. Walsh continues his appointment with his patient Elliot Harris.
I could guess, but I feel like I'd be way off. As far as the year, 2020.
Then by now, I think enough time has passed that you are due for your next Pap test.
Dr. Walsh is a third-year resident at CU's Family Medicine program and is part of the Denver Health Track. Denver Health is the safety net health system serving Denver County and has always treated queer and trans communities. But in recent years, there's been a concerted effort to train more providers and residents to be inclusive. Coming up, we check in with Denver Health patient Elliot Harris after his surgery. But first, we learn about a medical residency program that wants to normalize HIV care.
HIV is a chronic illness, and what do we do best in primary care? We take care of chronic illnesses, hypertension, diabetes, cholesterol, cardiac disease, all these things.
That's after the break.
In the NoCo is KUNC's News and Culture podcast. It's a great way to stay informed on the issues that matter most to our Colorado communities.
When people have the opportunity to help in a disaster, especially when they're fellow survivors, this can actually help with their own mental health and emotional recovery after the disaster.
I'm In the NoCo host Erin O'Toole. Follow the podcast for free at kunc.org or anywhere you like to listen to podcasts.
I'm Stephanie Daniel, and this is The Colorado Dream Ending the Hate State from KUNC News. It's a warm summer evening in Fort Collins, and inside a local gym, there's a co-ed recreational volleyball game going on. It's Team Cooper's turn to serve, and one of the women, Ash Neufeld, hits the ball over the net. Their opponent, Kick Your Ace, fumbles the return, and Team Cooper scores. Ash has been playing volleyball since she was a teenager. But for this 31-year-old, the rec league is about more than playing the sport she loves. It's a validation of her transness.
And so I was nervous to first step on that court. And it was the first time there was just a chorus of she's. Just everyone was so quick to see me in my womanhood, or at the very least in my special androgynous brand of femininity. This is what I've been wanting.
Ash is from a college town in northeast Kansas, and around 24 years old, she began socially transitioning, including using they/them pronouns and changing her name to something less masculine. But Ash says the way she grew up was not affirming of gender or sexual diversity.
I was coming out of that and existing in this community where people knew me one particular way, and it's I'm actually not that way, I'm this way, and it's just hard to live within that kind of contentious environment.
Ash moved to Chicago in 2019 and continued to explore her gender, which included also using she/her pronouns. A year later, she slowly began her medical transition.
And then eventually I got to a point where I was okay, I'm ready to go full dose with this. And that was when I moved to Colorado.
Ash moved to Fort Collins in the fall of 2022 to be closer to her sister and brother-in-law who lived there. But the decision wasn't easy. She wasn't sure she'd be able to access the same level of health care. Turns out, Colorado had her covered.
But it took me a while to find a provider who felt comfortable with providing me and prescribing me and managing my hormones. And then ultimately it ended up being an endocrinologist.
Ash had arrived in a state that is not only a leader in transgender care, but also has deep roots in this medical field. I want to go back to 1969 and the small town of Trinidad in southeastern Colorado. That year, Dr. Stanley Biber first performed what was called at that time a sex change operation for a transgender woman. Gender confirmation surgery, which is what it's called today, was an experimental procedure. The surgery was a success, and word spread across the globe. The term going to Trinidad became slang for getting this procedure. Over the course of 41 years, he performed an estimated 6,000 gender confirmation surgeries, according to History Colorado. On its website, the state agency says Biber was, quote, an ally and advocate for transgender people, even when doing so was politically and professionally dangerous. Today, gender-affirming care is available throughout the state. One way that happened is through a change in health coverage. Kate Harris is the Chief Deputy Commissioner at the Colorado Division of Insurance.
Back before 2021, we had been hearing that transgender folks seeking gender-affirming care services were really struggling to access those services and use their insurance, most importantly, to get those services covered.
The state agency held a series of public town halls to find out what people think should be covered by insurance. One of the responses was gender-affirming care services. So Kate and her team decided to get this added to the benchmark plan, which is the baseline set of services that private insurance plans in Colorado are required to cover. The Federal Centers for Medicare and Medicaid Services approved the new coverage. In 2023, Colorado became the first state in the country to explicitly include gender-affirming care services as an essential health benefit.
You know, we've heard from people who are able to get surgeries that they wouldn't have been able to perhaps otherwise, who are really able to, kind of live their authentic selves. And we hear a lot of joy around that. And that's been really exciting.
Colorado's Medicaid also offers this benefit. Depending on where you live, gender-affirming care for trans and non-binary people can be difficult or impossible to get, especially for young people. Nearly 40% of all transgender teens live in the 25 states with laws or policies banning it up to the age of 18. This year, the Supreme Court will hear a case challenging a Tennessee law that bans this care for youth. Colorado and New Mexico are the only Mountain West states to provide gender-affirming care to anyone. Many families and individuals are moving here for services, but it's hard to nail down the exact numbers. Over the past 2 years, Planned Parenthood of the Rocky Mountains has seen about a 30% increase in gender-affirming hormone therapy for adult patients. This includes folks traveling from Wyoming, Arizona, Texas, and other states.
I met with our new patient to the clinic. She's 22 and is a transgender female. Has never been on any kind of hormone.
That's Dr. Marisa Spires, a second-year resident in Banner Health's North Colorado Family Medicine Residency Program in Greeley. She's at the Family Medicine Clinic presenting one of her patients to her colleagues and supervisors.
Which is different than their birth name, and is kind of changing the way that she dresses.
Dr. Spires is learning how to treat transgender patients by working at the specialized clinic within the residency program. The clinic is called Primary Care of HIV, Hepatitis, and Gender and Sexual Medicine, or FIGS. Dr. Michael Renicle is the last person to chime in.
What are the other potentially high-risk background information or practices that could raise the risk for using estrogen?
Well, I think there are the things like liver disease, family history of certain types of
Dr. Renicle founded the FIGS Clinic in 2022, where primary care doctors provide gender and sexual medicine. They also treat people living with HIV.
HIV doesn't really care about orientation, doesn't care about gender. But here in the U.S., we know that gay men, transgender folk are disproportionately affected by HIV.
HIV is still a global epidemic. Approximately 40 million people are living with the virus, and tens of millions of people have died from AIDS-related causes since the epidemic started in 1981. However, HIV treatment has come a long way in the last 4 decades. If, through medications, a person can achieve and maintain an undetectable viral load for 6 months, then they can't pass the virus to others. It's a concept called U equals U, or undetectable equals untransmittable.
So now we're dealing with a chronic illness, but we know that the risk for certain cancers are higher in people living with HIV. The risk for cardiovascular disease is higher, cholesterol, etc. So these are the things we do really well in primary care, which is take care of all these things that we see, and then we just have to treat the HIV.
Dr. Renical is originally from South Africa and came to the U.S. to go to medical school in Iowa. He did his residency here at North Colorado Family Medicine. As an openly gay man, he wanted to get more training in HIV care and sexual and gender medicine, especially gender care for youth. He wanted to be that one-stop shop doctor.
You could come to my clinic and I could take care of your HIV, I could take care of your hormones, I could do your primary care, your preventive medicine, I could deliver your baby. It's so much less stigmatizing when you can actually go to a good primary care doctor and just it be the one-stop shop.
He says this primary care model means queer and trans patients don't have to see multiple providers like an endocrinologist or infectious disease doctor. And they don't have to keep recounting their health histories, which can be traumatic.
Having to repeat your story over and over again and not knowing how people are going to receive your story and if they're going to honor it and if they're going to care for it.
He reached out to Denver Health about doing an LGBTQ plus healthcare fellowship, but that type of program didn't exist. Instead, he got a faculty development fellowship, which he tailored to his needs, including getting an HIV specialty certification. After the fellowship, Dr. Renical returned to the North Colorado Family Medicine residency program. He became a faculty member and developed the FIGS Clinic to be a one-stop shop. The clinic isn't elective right now, but he's hoping it will eventually be part of the residency's core curriculum.
A patient who is here who has a history of HIV-1 infection.
Back at the FIGS Clinic, Chief Resident Haley Petrick is presenting now.
Today is actually following up about polycythemia or high red blood cell count.
Dr. Petrick will finish her residency soon and then plans to work at a family clinic on Colorado's Western Slope. There, she'll provide a variety of services, from delivering babies to gender and HIV care.
As a family medicine physician, it can feel intimidating to want to do HIV care. But I think one of the things I've been really surprised by is most of HIV care is good primary care. So I think it very much belongs in the wheelhouse of family medicine, and I think family medicine should really take ownership of it.
Hey, Elliot. Hey, Stephanie. It's good to see you. You too. I'm good.
It's early June, and I'm meeting Elliot Harris at Washington Park in Denver. It's been about 3 weeks since his surgery.
I feel like top surgery is a major surgery. It's a big decision. It's life-changing. And most change has its ups and downs, and it's good and bad.
As we sit on a bench overlooking the lake, he says he's happy with how his chest is looking. However, the recovery has been painful. He got a bad skin rash, and the compression vest is uncomfortable.
As time went on and I really thought about and sat with like my true feelings, I realized that like this was the correct choice for me.
One of the people who has been by Elliot's side throughout this whole process is his longtime partner, Calvin, who is also trans. They got engaged a few months ago. Elliot isn't from here. He grew up in Philadelphia and lived in Phoenix for a while. Colorado, he says, feels like home. But even here, in one of the most LGBTQ plus friendly states in the country, being transgender isn't always easy.
I did have a coworker like freak out on me about being trans, and even just generally at my place of work, you know, there are those obstacles of like being misgendered or people just straight up being hostile because of my transness.
Despite all this, the state's healthcare policies have helped.
I feel very free, you know, like there is a mental and physical weight lifted off of my body and my mind.
It's been nearly 30 years since the Supreme Court overturned Amendment 2, which sought to prohibit legal protections for LGBTQ plus people, and now Colorado is a leader in gender-affirming care. As we've heard, it's allowed transgender, non-binary, and other people to live their authentic selves. For Elliot Harris, he says he feels content and happy. He's at peace with who he is as a trans person. On the next episode of The Colorado Dream Ending the Hate State, we hear how parents and students are navigating gender identity at school.
If kids are afraid to tell their parents, that's information. And we need to listen to them. And we need to say, okay, so why would your parents not be included in this process? Let's talk about that.
That's next time on The Colorado Dream. The Colorado Dream Season 4 Ending the Hate State is a production from KUNC News. This episode was written and reported by me, Stephanie Daniel. Editing by Sean Corcoran. The theme song was composed by Jason Patton. Michelle Rado sound designed and mixed the episode. Jennifer Coombs is the digital editor. Special thanks to Trayvell Anderson, Lee Patterson, Scott Franz, Brad Turner, Jen De La Fuente, Kim Race, Robert Leja, Gabe Allen, Desmond O'Boyle, Rachel Cohen, and Mike Arnold. Tammy Turwelp is KUNC's president and CEO. The Colorado Dream is sponsored by the Colorado Community College System. To see photos of the people included in this episode and learn more about the terminology we used, go to kunc.org/Colorado Dream or check out the show notes for a link.